Okay, so thank you all for showing up today. Today's Zoominar is going to be in English, and we are going to talk about overall posture. How can we change this posture for our body, for our everyday usage? And it's really important that if we're able to somehow, after getting adjusted, getting treated by your chiropractor, and you know that you have to stretch, you know that you have to strengthen once in a while, well, the next thing is constant good posture. How do we really get to a constant good posture? By doing that, let's start looking at what's really important. Let's go back to the anatomy. What's really important is the anatomy of our body. Our neck is really unique. It has 7 vertebrae. Okay, on top of it sits our skull. The first vertebra, which we call atlas, is really unique in a way that it has 2 condyle. If you look at this, the 2 condyle is open. This gives you the ability for your skull to rest on it, and that gives you the ability to nod yes. Okay, and the second, it's what we call the axis, which is really important. It has this sliding point, which gives you the ability to rotate. When your entire head and first segment is on it, it gives you the ability to say no. And then after that, the rest of it actually receive weight. It's really for weight bearing. Around the structure, we have muscle. And with that, we have also the ligament, and then you have the spinal cord. Now, this consists of our entire upper body with the disc. That's a completion of what holds our head. Okay. We often don't really think about how our head position is after 6 months. Why do I say that? Because as a fetus, we don't have that curve. It's when we start lifting our head, we have that curve. But then after that, we lose the curve. It's because every day when you look down, all the weight, all the pressure that is from your skull and your head, which is 8 to 13 pounds, presses down all the way. And the first thing that happens is you lose your curve. Once you lose your curve, all the rest is history. The formula I've given you is gravity plus weight equals degeneration. So if you write that down, gravity plus weight equals degeneration, that means your skull is quite heavy. And the skull adds on to that loss of curve. It will slowly, with your own weight and gravity, it'll degenerate and degenerate through time. If that pinches on that nerve, which the nerve goes to different parts of your body, each part of your body is supplied by certain segments of your nervous system that go through the vertebra. So in C1, it causes everything. It could disrupt signals going to the entire body, cause your headache feeling. C2 could go to your eyes, also still could cause headache, sometimes tonsil issues. C3 could go to sinus issues. Each and every one of these, your throat, your glands, your thyroid, down to your hands and your fingers. It is said we all have this. We all have this running system in our body that we don't pay attention to. So in doing that, let's go over this. How do we really take care of this body? Oftentimes, everyone asks me, how do I sit? How do I sit? How do I stand? How do I work? Well, there's so many pictures. I just searched the web, and you could do this on yourself. And there's so many things to follow. What's more important? Even for standing, okay? What I think is most important is this. It's the neck posture. Because the balance is in the ear and your eyes, if you're able to keep your neck posture with your ear and shoulder lined up straight, then everything else becomes easy. For example, the most cheapest thing that you should invest on is all these stands. If you look at the top left-hand corner of this sharing, I like you to buy things that are not just rested on the desktop. That still gives you your head tilting forward and down looking. I prefer you actually buy anything that raise a little, it has a little increased height on the table. So top left or somewhere in the center, you can see this. And also for laptop as well, I want you to pick things that actually give you the height advantage, that you can adjust height so that it could be as high as where you look straight forward. Higher, the better for now, because in this current era, everyone is looking down. You can even buy on the left middle column here, you can see that it has a standing stand on the floor, from the floor to top. Sometimes if you sit in sofa a lot, you could actually buy this one. These are, some has a rolling stand that goes around. You can see all these difference on the internet. Standing desk, same thing. The key is your screen is low. It's not high enough. You may have a perfect standing desk, but that screen's got to go up. Now, take a look at this picture. How's the smartphone damaging your neck? Well, not just the smartphone, the screen. Look at the degree. If your head, without being straight with your shoulder and ear lined up, it's 0 degree ahead. It's usually 10 to 12 pounds of your own head weight. But if you tilt 15 degrees forward and down, that's 27 pounds. It's double already. If you tilt 30 degrees forward, that's almost quadruple, 40 pounds. And then 45 degrees, 60 degrees. And so on, you know how heavy your head has wear and tear to your cervical columns. Okay, now let's run over some of the most common things that we actually buy. Due to pandemic or even not pandemic, we buy all sorts of gadgets. I'm sure you got some of these. Some of these are just scraping tools. Some of these are automatic. Some of these were high vibration frequency massager. Some rolls around your neck. Well, are any of these good? My patient often asks. They're not too bad, but I will tell you something about what I've experienced from my patients. If it's high frequency vibration, don't use it on your neck. If it's just a massager that you use your force and it's on the muscle level, sure. If something goes wrong, you will feel it the next day or right away. Okay, so when you don't know what you're doing, don't do it. But when you find that it helps you, sure, whatever helps you. I am not in the position to tell you what's good, what's bad. I'm only in the position to tell you what I've seen. I've seen, if you see the top left-hand corner, the best massager tool, that's what they rated. It's one of those. And so it's a vibrational, like a massager. Do not ever use the tip on your neck. You can imagine how easily it can misalign your neck. Yes. Okay. So that's number one, no. Anything else is fine. You're supposed to use that on bigger muscle, like your thigh. You know, it's big thigh muscle, hamstring, things like that. Much safer. Not on your spine. That's not a good idea. That vibration can easily help you bring up some old problems that you have or some scar tissues, help you misalign some of the things that are already waiting to be happened. So I would strongly recommend don't do that. And next, let's take a look at, we have a lot more. Now, if you've never seen, some of these are rolling, good for your feet. The bottom two, I never thought that they're helpful. I came across one. They're kind of smooth and it pinches in your neck. That's not too bad. Things that you can use, these are really just kind of self-help, but nothing beats good stretching and good posture change. Okay. Elastic band. This is the one that you actually can strengthen your neck muscle, back muscle. So elastic band is the cheapest, easiest thing that you could actually take while you travel that you need to strengthen yourself. A loop one is a lot easier to use than a long one where you kind of have to hold on to it. Okay, these are your choices. Massage balls are something that we also often see. These balls are good, useful if you know how to use it. There's videos. If you want to know, there is this role model book. I forgot the name of the author. Maybe we'll pop it up for you to see. Role model, meaning roll, R-O-L-L, rolling, roll, model. That's a good one. The author did a great job on using all sorts of ball. But then once again, these are temporary self-help. Yes? Okay. Now here's another one I would recommend. This is probably worth looking into and investing. If online, you can just easily type cervical relaxer or traction, somewhat. This is really pretty much just a pillow. And with this pillow, you can actually rest on it and before you go to sleep or noontime when you take a nap, or even every hour if you have neck issue, trying to restore your curve. That's the key. The key is to try to restore your curve from everyday usage. The next I wanted to share is using some of these equipment. Some of the most common seen is that These are, this is a Ziploc bag. I'm sure you can find at home. Okay. Or you can get a 1 pound long grain brown rice. Okay. That's also something you can use. Why 1 pound? Because now we are going to use these over our head to actually help us position ourselves. Okay. Now, if these plastic bags are too slippery, you could actually use a cloth, put it inside the cloth so it doesn't slide on your head. Before you put this on you, do not put it on while you're slouched over. I want to make sure that you actually have your head, shoulder all lined up, and then you can put this piece of weight on your head. In doing this exercise, first thing I want to show you some of these trigger points. All the muscles that are attached onto the base of your skull or to the mid back, to your shoulders. And you can see that where the X is marked, that means if you have tension there, the pain is where the colored blue parts are. So this muscle is trapezius. And if you have tension in the right side of the trapezius, you may have pain showing up as like a headache, temporal headache, or even a jaw pain. If you have, you can see the second picture where the mark of the X is real in between your shoulder blade and top of the left shoulder. It gives you a whole entire back, neck, sore sensation. So these are all things that we call referral pain. Now, if you look at this one, this has got semispinalis scapularis. That's actually very deep, but it's one of the muscles that goes pretty far and long from your base of your skull all the way down to your T-spine. Thoracic spine, mid back, as we call it. Well, that little tension you have in the suboccipital region, what we call below your occiput region, could give you some sort of headache temporal feeling or behind your eyeball kind of feeling. And that's muscle referral pain. Okay. And this one give you a top of the head muscle referral pain. So in all this, all these neck muscle can be trained and can be modified. Now, this is also C1-2. Earlier, I've shown you the anatomy of C1-2. Well, in C1-2, when your head looks down and turn, most of your, I would say about 80 to 90% of your everyday usage, that's nodding and turning and saying no and yes. These muscles, when it's actually overused or being strained or pulled on, will give you that same sensation as a temporal headache. Okay, these are the things that we don't think about. The SCM, one of the biggest muscles in the front neck region. Well, this one, whenever you look down and turn your head, you are using it, and which we do it all the time. The minute you look down, you turn, look at your phone, or you're looking at your iPad, you're using this muscle. And you can see the mark of the X of that muscle. It gives you a headache. It gives you top around the ear. It gives you jaw pain. It could give you anything from above your eyes to eyebrow, around your eyes, and then behind. So these are mocked sensations of pain that you may not know. You could easily resolve them. Okay. This is called the alleviating scapula. That's really behind. It connects your scapula to your cervical region, and that gives you the same sensation of neck pain, shoulder pain. How do you know which one you have? We don't. You have to go see a doctor. But the key is, I'm going to teach you things that you can actually prevent yourself from overusage. So the key is, number one thing I want you to do is to think about that when you can start changing your posture, change your habit, the neck posture does matter. And so with that, I want you to start thinking about, I want you to roll your shoulders front to back. Okay. Bring your head back. Okay. Let's repeat that again. I want you to roll your shoulder back. Bring your head forward back to the center. Now put the bag over your head. Once you do that, what I want you to do is stay in that plane line, and you could turn your head side to side all the way without turning or moving your shoulders, without having that bag fall ahead of you. Okay. If you're able to keep that, that means you kept your head in a good position. Now I want you to go forward and back. So you could practice that, going forward and back. These are the things that you could actually practice on your own. And with that, you could actually get used to the feeling with 1 pound on your head. turning. Notice that the shoulder's not moving, only the head. Okay. When I turn really far to the end, the shoulder might move just a little bit, but you're trying to stabilize. You want to find that center line of gravity still straight. Okay. So that is key. Go forward and backwards. Notice that this is often something that we don't do. And you go as far back as you get double chin. You see, notice my nice double chin there? Okay. So forward and backwards. And that's really important without having this back fall down. Okay. Now, next, we're going to go through using a little tool. Something that you could buy. This is from Daiso. Very, I think it's only what, $2-3. Now there's fancy ones that cost as much as $30 and or even $40. And so this is something that you could just put behind you and pull. Okay. Okay. Here, once again, all you do, what I want you to do is press down. And all you do is move your head up and down or side to side. Okay. The key is that nod you're pressing down is not moving. And you could turn looking down, or you could just go up and down. You could switch side, and it's always from the side of your spine. You're not on the spine. You're about an inch away to the side. Okay. And then about there, wherever your sore spot is. Okay. Hold it there and pull down. And what I want you to do is just move your neck motion, because all these muscles are attached to your skull. By moving up and down and turning side to side will give you that nice release on that nod that's tensed up through the day's usage. Okay. And you could tilt sideways. So bottom line, it's up, down, side to side, turn side to side, and tilt side to side. Let's show you a front back view. Pretty much you're holding it down and then you turn your body, don't turn your body, you turn your head. Okay. And then on the other side, we'll show this again. You could turn and you could look down, straight down, up and down. It'll give you that release. And then you can turn and be released of that. Okay. So the key, once again, today we went over what's really important, which is constant good posture. Okay. Daily stretching, etiquette strengthening, constant good posture. The good posture starts with your head balancing your entire body weight. So the key for today is to use your head in the right position. Well, I'll show you my screen where we get online and go to YouTube. Let's see. All right. Can you guys see this? Okay. So on YouTube, okay, when you go to YouTube, go ahead and just search my name. Okay, now you can see this. Click on any one of this and go into inside of it. Can you see that? The first one, the daily exercise with a minimum. Now, this is one that I strongly recommend for now. I uploaded this. I re-uploaded this. We're going to skimp this. Okay, now you do see that on the bottom. Oh. See, there's a more here. If you click on more, we already tab these so you can jump. There's strengthening of the neck, core muscle. There's stretching of the neck, which is the yoga block is here. There's a neck. So if we jump, okay, you can see that it actually goes straight into how to use the yoga block. And on the bottom here, it has all this. You actually can jump from wall stretch. Okay, so either reading the tab here, or you could actually just go into it by looking at the picture. And there's actually there's also the cervical pump. These are the most common things I've taught my patients throughout the years. And this video was made a long time ago, as you can tell. This was made, I just uploaded, re-uploaded, but it was made in 2016. Okay. These are the things that, except the one I taught you today is not on this video. But in here, there's wall stretch. This is the most common one. I've taught you how to do wall stretch if you stand against the wall. And there's also wall stretch and office chair stretch. So it's ready for you guys to just jump to the segments, and it goes through the motion. It has even a little picture on the side to show you how it feels like. Okay. This one is the full body one, which it has strengthening of the core muscle. It has strengthening of the neck and upper back muscle. These are pretty safe if you have back pain. Most of them are done laying down or sitting. And there's some stretching of the leg on the bottom. Okay, so this is it for this month. Thank you all for coming for today. And I'll see you guys next month.